health literacy that most of us bring to the world is very small. And until we see it illustrated or on a video like you've done, you really just don't get it till it happens. So thank you for doing that on account of all of us who've had inflammatory bowel disease.
Well, thank you. Yeah, I mean, that's the goal is to try to boost health literacy out there. So much of the trust there was in the system has since eroded over time, and having greater transparency and explaining things in a digestible way, I think is one way I was trying to go about that.
Was there a pun in there? A digestible way?
Yes.
Well placed. Well
Wasn't-
done.
We're on the road to nowhere. Come on inside.
Hello, and welcome to the Fire Chief Podcast, the only podcast dedicated to the Chief Medical Officer. I am your host, Lee Scheinbart, and this podcast brings you the most crucial conversation in healthcare leadership today. Today's guest is Dr. Austin Chang, an interventional gastroenterologist and the inaugural Chief Medical Officer of the endoscopy arm of Medtronic, the global medical technology and device leader. Dr. Chang earned his undergraduate degree at Duke University, earned his medical degree from Columbia University, and trained in internal medicine at New York Presbyterian Hospital. He further specialized in GI and bariatric endoscopy at Brigham and Women's Hospital and earned an Master's of Public Health from Harvard's Chan School of Public Health and completed his training with an advanced endoscopy fellowship at Jefferson Health in Philadelphia. Austin maintains his clinical practice as an assistant professor of medicine in Philly. So, Austin, are you ready for this?
Yes, I'm totally ready.
But you do or do not have your cup of tea, by the way.
I don't, but I should probably stay hydrated somehow.
Well, for those who have never listened to Austin's show, he offers his guests a cup of tea or sometimes some other magical
Yes.
drink in the teapot. And I've enjoyed watching that very much. So we'll do this like COVID, like when we social distance and had virtual cocktail parties. We'll do some virtual tea time, we're almost at a traditional tea time, right?
That's true. Yeah, it's that time of day for sure.
So, in addition to your current role at Medtronic, which we'll get into in a minute, I first heard about you and really wanted to have you on the show when Stephen Klasko told me about a role he claims to have created while he was CEO at the Jeff. And if I understand correctly, Dr. Klasko advocated for a chief medical social media officer at Jeff, and you were the first to fill that. Do I have that right?
That's correct.
So, let me tell the audience a few more things about you to give them the context of why I'm so interested and intrigued in you and your accomplishments. So, you're clearly an amazing advocate for patient education, very influential on social media with over 700,000 followers and 180 million views across all platforms like Instagram, TikTok, and YouTube. A strong background in social media research and the founding president of the Association for Healthcare Social Media. And in 2021, you were the GLAAD Media Award nominee, and 2024 named among MM&M's Healthcare Marketing Influencer Top 25. And you've been featured on many various events like South and Southwest. And you're on the inaugural YouTube Health Advisory Board. And in 2022, had the honor of joining the White House Healthcare Leaders in Social Media Roundtable. That is serious stuff. And then in 2024, last year, right at this time, you went old school analog on all of us and published a book.
Sure did.
Yeah, called Gut, an Owner's Guide, an illustrated book aimed at educating the public on gut health and GI innovations. Tell us a little bit about that book, please.
Yeah, it's I didn't necessarily have a plan to write a book at the time, but was approached with the idea of doing so, and I thought, given the illustrated format and color, it was the exact kind of book that I'd want to put out. And there's just so much misinformation out there, as we all know, about all aspects of healthcare, and gut health is not immune to that at all. And so it gave me an opportunity to just speak in a way. I was directed to, use my social media voice to write this book. And after each chapter, there's a kind of myth busting section where I dispel a lot of common myths. It also allowed me an opportunity to talk about just innovation in general, a timeline of all the cool things that, you know, were developed over the years within GI, and also give me an opportunity to highlight just the cool technology that we come across in my field, and what the patient experience is like too. Because I think a lot of books out there really don't focus on technology, nor does it focus on what patients will truly encounter when they go to the clinic or the hospital, and who all the different people they might come across are. And so I wanted to make sure there was a resource like that for everyone.
I personally and professionally appreciate that you've done this, and I'm going to share why. I was diagnosed with Crohn's disease in medical school. And it's a long story how I ended up not knowing that I had it until I found out that I did have it. But as a medical student, I was taken to the health clinic, and from the health clinic referred to the GI attending, and had my first colonoscopy. I knew nothing. Had I had a book, which is all that we really had at the time, with a visual description of what the room would look like, what the device would look like, what the experience might be doing for me and figuring out what's going on, would have been a game changer, even though I was a young man. Whether the health literacy that most of us bring to the world is very small. And until we see it illustrated or on a video like you've done, you really just don't get it till it happens. So thank you for doing that on account of all of us who've had inflammatory bowel disease. So I think it's a wonderful addition to the way we think about patients in the future.
Well, thank you. Yeah, I mean, that's the goal, is to try to boost health literacy out there, try to, realign what people's understanding is with healthcare. So much of the trust there was in the system has since eroded over time, and having greater transparency and explaining things in a digestible way, I think, is one way I was trying to go about that.
Was there a pun in there? A digestible way?
Yes.
Well placed. Well
Wasn't
done. But look, visual learning, as we're learning about education, I mean, we are naturally visual learners, so it's a great way to start the conversation. So we'll call a timeout, hit rewind, and go back in time. When you entered medical school, did you have any aspirations on reaching the level of healthcare executive, taking on these system level roles? What was in your head back in school?
Honestly, not back then. It was just, let me try to figure out what it means to be a physician, try to sort out what specialty I was going to go into. I mean, I think, like many of my colleagues, we probably go in with very lofty aspirations of wanting to help a lot of people and have some sort of impact at a population level. And for me, what I discovered over time was a lot of the patient care I was actually delivering was one-on-one at an individual level. And I think that there were moments along the way that I think it became a little bit dissatisfying. And so I wanted to, explore other ways of doing that. And I think one way of amplifying my voice was leaning into social media, and educating in that medium.
And you conducted some sort of research in the space of social media. Can you expand to our listeners what that was all about?
Absolutely. I think initially when I've always been a fan of social media and believe in its reach, but it wasn't necessarily accepted when I first got on the internet. I think a lot of people thought that exposure was a liability, and, just was not a worthy use of my time. And so I was actually encouraged by some faculty along the way to turn it into more of an academic endeavor. And that's why I started doing social media related research. And we began by looking at trends on social media around conferences, academic conferences, and the general discourse of what was being discussed around GI conditions on the internet, and looking into the how valid, or what the prevalence of misinformation was like, and so it would better kind of inform what we should be doing on social media, and that's sort of how it all began.
Yeah, no, that makes a lot of sense to me because as part of my work in with Crohn's and the Colitis Foundation and other patient advocacy work that I've done, the chatter out there on some less than ideally moderated apps is extraordinary, and it's happening whether we want it to happen or not. And I think having that scientific approach, look, there's a value equation here. Let's see if we can investigate that and use it in a way. Look, there's nothing wrong with chatter for me to talk to a buddy halfway across the country and we talk about our issues, but that isn't the greatest way to get medical care or medical information. Am I getting that right?
Yeah, and I think I recognized early on that, people get their information from different sources, and most of the time, it's not from their physician or their care provider. It's, through the media. And increasingly, we're seeing people get their medical knowledge and health knowledge through social media rather than traditional forms of media, even. And so today, I feel like it's almost accepted that there is an intersection between healthcare and social media. But when I rewind back to when I started over 10 years ago, that wasn't as apparent. And we kind of had to prove that there was this sort of connection. And what I think really turned the tides was COVID, and how we saw the impact of public discourse on the internet driving, public health outcomes and acceptance of public health policy. So now we sort of take it for granted that, yeah, that this is there's a definite impact that social media has on healthcare, but back then it wasn't as, at the forefront.
Yeah, and I think we're going to touch on that in just a moment, some of the information exchange that occurred in and around COVID.
Mhm.
So, okay, so we're still in the time capsule. It wasn't your first thought to end up where you are today. So, going back in time a little bit, what was your awareness about the ecosystem of healthcare
Yeah.
and systemness? And while you were growing into your clinical competency and looking for something else, as you've already described, what was your awareness of the big system at that time?
Yeah, that's a really fantastic question. I think it was my understanding of the system at that time was probably not even something that I was taught as much in the classroom in college or medical school. I did take some public policy classes in college, but then even in medical school, I think what I carried from my previous experience was some understanding of certain areas. So when I was in middle school and high school, I actually lived abroad in Taiwan, and we operated there under a single payer health system. And the transition to a single payer health system sort of occurred when I had just moved to Taiwan. And so there was a lot of awareness around that shift. So as a child, I sort of saw that play out, and I could kind of understand in real time some of the pros and cons of operating in a system like that. And then when I actually, pursued a medical career and made my way through medical training, I had mentors along the way who kind of gave me a glimpse into certain other areas within healthcare outside of just clinical practice. And I often cite Dr. Eve Slater, who was, had once the first female chief resident at Mass General and a cardiologist, and who ended up working in pharma and then also in the government as, I believe, like Deputy Secretary of Health and Human Services or some sort of role like that. And so when she returned to be faculty at Columbia, she pulled me aside and actually told me you should really think about like everything outside of clinical medicine, like view your career more kind of on a global scale. And at the time, I didn't quite understand what that meant, but it sort of planted the seed that I should be looking more outside of clinical practice alone. And so I think that along the way, then when I went to fellowship, I pursued my master's in public health. That definitely gave me a more structured way of learning about the health system, health ecosystem in general. But I also, that was my first time dipping my toe into, some startups and helping advise. And again, some of my mentors in fellowship as well were very entrepreneurial, had other kind of startups they were involved with or had founded. And it wasn't so much that I was involved in those directly, but just to know that there was, this other world out there that directly was related to what we were actually doing or ended up that pipeline of innovation would end up, you know, being a part of how we practice medicine.
Um, you're making me think of things that I haven't thought about in over 35 years, and they're extremely insightful. First of all, the mentor that said, "Go global in your mind," not the exact words. I love that, and I am going to tell the students that I work with, the old phrase, "Act locally but think globally," because I do think it opens your aperture that there is something else going on. So that's number one.
Mhm.
Your progress through your clinical training, as with mine, I did a fellowship in hematology and oncology. And the longer I trained in the different systems and models, and particularly oncology, there's a new drug. Tomorrow there's another new drug. You have a new device, you have a new imaging adjunct for your work. I get another drug, I get a PET scan, you get a new device, I get a new immunotherapy. You
Mhm.
begin to see there's this entire universe, an ecosystem of things that are happening, as opposed to, yes, you're dealing with a patient, but when you come up, you see this whole different world around you. And I've never really put, so like you're not thinking about it in school. The school isn't giving you a lot of attention. The old paternalistic, like you can't advertise, you can't put your face out there, dismissive of social media as unprofessional. Well, this is the world we live in today, guys. So at some point we have to address it. And if only by osmosis we realize there are much bigger orbits to go to, it does help us succeed in a very, very complex world. How does that resonate with you or not?
Yeah, oh, absolutely. I mean, I think that, you know, what it boils down to is that there's so many pieces that play into what determine the health of a population, and executing clinical care is only one aspect of it, right? There's a whole economy around this, and so many folks, involved. And I think that we historically have been so siloed in how we work that my opinion is that innovation could definitely be accelerated if we worked between silos and if we had more people bridging, different worlds. And that's kind of where I'm finding myself these days, is I'm sort of at the intersection of a lot of different worlds, which isn't well defined, but it's also exciting to be
Yeah.
able to, learn from one world and be able to share that knowledge with my colleagues in another world.
As far as I can tell, you're in a really cool spot right now. But we're getting ahead of ourselves. So one more quick question. Well, there's probably more than one quick question. So tell us how this interest in social media and the advice about let's do some research lead to the position and the role, and maybe a little bit more about the why should a system, a healthcare delivery system, create a chief medical social media officer. What was that all about?
Yeah, I think, you know, like I mentioned, people are getting their medical information from social media these days. And not only do they, receive their information there, but they're also looking for people who are relatable and that they actually want to engage with. So just because somebody is throwing data at them, it might not resonate. It has to be delivered in a certain way, that is palatable and, gets the message across and clear. And that's sort of why I actually had this natural curiosity, even sort of before social media, before I got into social media, with just who gets to decide and vet what shows up on your evening news. And how does information go from the medical journals to the evening news? Like, who gets to decide that, you know? And that's why I spent some time at ABC News behind the scenes, as part of the medical unit, to understand that process of how, okay, the journals have these embargoed press releases, and then there's folks who are actually selecting and vetting that information before, it's transmitted out there to everyone. Um, and when I first started, I did have to kind of ask myself, okay, what do I hope to get out of this, and what is my true purpose in doing this? And as we see today, there are a lot of, professionals now who have gotten on social media, and many of them have different motivations for being on social media. And all of them are valid. It's not to say that one isn't and another is. Some people are there to build their practice and raise awareness kind of locally at a community level. Others are purely there to kind of educate. Others are there to advocate for certain causes. And there's even other folks who are using social media and their monetization, mechanisms to actually supplement their income. Nothing wrong with that, as long as it's done appropriately. And so that was sort of, I made a conscious decision to really focus on the education piece of it, try to be an objective voice, and wait until I was actually farther along in my training to actually dive into it, because I didn't want to feel uncomfortable being like an authority or being positioning myself in a way that I shouldn't be. And I sort of, described this story to Dr. Klasko as I was exiting training, and had mentioned all the social media research that I was doing and how I was kind of starting this nonprofit, organization to help educate other health professionals on how to use social media alongside several of my colleagues who had been doing it kind of just like me
Hmm.
online, and also my experience in working with some of these platforms directly, whether it's Pinterest and YouTube and Instagram and TikTok, etc. So all that combined, he sort of heard this story and thought, well, why don't we have someone like you? There aren't too many of us out there that he had encountered
Hmm.
to help inform the communications team, to help shape the social media policy, and kind of try to build it into the curriculum, perhaps, for the medical trainees, and also just help out with the social media campaigns. And so, of course, I jumped at the opportunity that he created, and it was great to have a little bit more insight even from that lens, through the hospital and health system lens, in understanding how they go about communicating with their communities.
Yeah, yeah. And does the role still exist at the Jeff?
It does not. I vacated the role
And
after another.
nobody else to this time, nobody else has yet come into the role. So, well, look, it is going to be part of our future one way or the other. I am not personally aware of any other major system, only because I'm newly aware of what we're talking about. Do you know if other health systems have dedicated physician social media leaders?
Uh, Other academic health systems, not at the scale of the entire health system, but I do know folks who are kind of have been given roles like within a department. And so that, at Stanford, for instance, I have a colleague who's there with the pediatric department, working on this as well.
Yeah, so great, because this leads to the next question. See, I always lie. Like I say, I have a question as one question, and then I lie and I ask more questions. But that's because of this tea that I am drinking today. I have the Bengal spice. I got this tiger going on
That
here.
sounds
So
good.
it's like, I got you. So, in your opinion, right? So, you would think that more academic medical centers or healthcare organizations in this world of lowered trust. I mean, the profession of medicine is still considered a noble one, as is nursing, maybe not as high as it used to be for a variety of reasons, but it's still highly regarded. But the trust meter, is going in the wrong direction. And this is a great way to move that trust meter back by everything everywhere all at once with the right and appropriate and helpful information. You would think that more would be doing it. What do you think is that? Is it the traditional healthcare inertia slow to change, or you have some other ideas why it's not rapidly adopted
Yeah,
across systems?
yeah, I think it's really challenging because to have it's very time consuming to be on social media, first of all, and simply having an understanding of it and going to school to study social media is different than actually personally using social media and understanding all the different platforms. And I think as more platforms are developed and all of them are increasingly more complicated because they keep on rolling out new features, it's really hard to keep up with. And there's often no incentive for people, for doctors and nurses especially, to take extra time to talk more about medicine and healthcare outside of their day jobs. And that's going to be a challenge. And what's what I've also found is that I think why it can be frustrating is because that trying to re-educate, you know, everyone out there about medicine isn't just about teaching them health facts or about the disease states or about the procedures. It's also teaching them how to think like a health professional, how to navigate the gray areas and how dynamic health can be. You know, evidence changes and we have to, you know, critically think about that evidence and know how to assess it. And that's not always easy to convey to, you know, the average non-medically trained person out there.
No, it isn't. And I'm in the space of leadership studies and organizational leadership and adult learning. And when you begin, so to everything you're saying is blowing up in my brain as a perfect opportunity to utilize all of the algorithms and all of the features in a way to, again, move that trust. I will be clear in my communication. I will be consistent again and again. So you're not confused. I'll make it at your level or find a way to reach you at your health literacy. And maybe we're just still at the horse and buggy of medical education and trust building when it comes to social media. So maybe I have to get you back on the show in the future and see what we've learned about that.
Yeah, well, it's hard to like package something in a very tiny, you know, 15-second soundbite to maintain someone's attention for that full duration, to make it fun and interesting and, you know, compete with all the other entertainment out there, essentially competing for people's attention.
Yeah. So we live, everybody in your space, you know this, I'm new to this. We live in an attention economy and we're competing for each other's attention and it's economized and monetized. And I am on board with what that I use this, although we may or not debate this is social media, but I use the format of podcasting as an educational tool for young aspiring physician leaders to raise their awareness of the systemness and what's out there to help them choose or pursue very important roles. Does that make sense to
Yeah,
you?
absolutely. And I think the role of podcast is super important. Not everyone, you know, gravitates to, you know, the same app, and people have different ways of learning. And, you know, when I used to have a long commute, I would listen to podcasts all the time, and so, you know, we have to tackle this from a lot of different directions.
Yeah. Yeah. Okay, so I'm gonna almost pivot a little bit more. So there are people though, and I just had a guest on the show who deals with national security and national policy issues. It's not just misinformation, but proactive malinformation and info wars. And so you and I and everybody else who lean in on this type of thing are being swept along in a direct campaign to provide a different view of information. And there are look, I talked to the chief medical officer out in Lubbock, Texas at the Children's Hospital where the epicenter of the measles outbreak was
Mm.
just a few months ago. Of course, it's spreading, so I don't even know where the epicenter is anymore. And she made two comments to me, and her heart was broken over the death of the first child in her institution. One, she had to stop reading all the comments on social media. That was killing her. Totally understand that, and she took her own good advice. The second thing, though, and we had appointed government officials go and visit there, who then prop up local providers who are using social media to advocate, like in COVID, treatments we are about 99.9% sure have no material value in treating human beings with COVID, and they're doing the same thing with measles. And it's so overwhelming, the deliberate nature of this information. And to your point, and I agree, we do have freedom of speech, and people have the right to do these things, but there is a wrong way to do things as well, and we have to. Sometimes we just have to flood back. We have to flood back the right information. Okay. Anything else on social media?
No, I think we covered it
We
pretty well.
covered it.
I mean, I could
Okay.
go on forever, but you know, I
Yeah.
think that this is a good
I,
over.
I I could do this forever. You probably have better things to do with your time. I'm at that late stage in my career where I have a little bit more freedom. So,
Oh,
how did you arrive, therefore, at Medtronics, and particularly the role, and what is the most important daily work of the CMO of endoscopy and all of that?
Yeah, that's a great question. Good segue. I think when also an opportunity that I didn't anticipate, having when I set out to, go through this whole medical journey. This was not where I thought I'd end up, at least at this stage in my career. But I was approached, kind of a cold called by my former boss, who was the president of the business of Medtronic's endoscopy business. And so he said, we've never had a chief medical officer for this business at Medtronic. Would you consider? And I was caught a little off guard, but did a lot of soul searching and information gathering. And I thought that, again, this was sort of a good way to have a population level impact. In a way, I had always been trying to do so with social media and health information and knowledge. But now this is actual other kind of more tangible way of getting technology out to all the doctors to advance patient care. And so I really jumped at that opportunity, and the fact that it's a global role and gave me an opportunity to learn more about the ecosystem. And sure enough, that's the biggest takeaway of the past 3.5 years that I've been here, is that I've gotten such a different perspective on how all the different elements within the healthcare ecosystem come together, whether it's academia or our professional societies, the federal government and reimbursement and payers and et cetera, all how it all comes together. And so I was given sort of free rein when I first came in to understand the business and identify areas that I could help improve. And so from those conversations around, what I discovered, I ultimately ended up leading medical affairs, medical education, clinical training for our whole sales force, and navigating all the relationships with professional societies and our KOLs. But as an individual contributor as well, I'm providing medical input into every business development conversation that we have with a startup company, and helping out with reimbursement efforts and going before the AMA CPT editorial panel. And so I've been able to see, how every function also comes together within a business to execute. So yeah, I would say, gosh, it's hard to pinpoint what the most important part of the role is as chief medical officer. But I would probably sum it up as just being that bridge between the clinicians and the patients, representing that voice internally to help, make sure that we're developing technology the right way and identifying what the needs are from the field, to make sure that, our patients are getting the most effective and safe technology out there.
So you're see, my trust meter is going up because I know that when my pancreas blows up. So did your fluoro time get better or worse moving into the CMO role?
A lot better. That was, I'm so glad that I'm not as exposed to radiation anymore.
Yeah. So
Although I will say I do, my travel, has definitely increased. And so the time in the airplanes, I don't know, I haven't,
yeah, you're getting a lot of exposure up in the atmosphere for sure.
yeah.
That you'll have to figure that you'll have to wear your badge basically 24/7 to check yourself out. No. But I mean, no, seriously, so your clinical skills, obviously you want to maintain them in the ERCP suite and so on and so forth. And, but so I would submit to you, because this is what happens to us sometimes. And I was at basically the command post during COVID for our health system, a sizable system. You become the clinical conscience of the organization, and I think if this is such a natural, I've only known you a brief time, very natural fit. You believe in educating people, putting the right language around the right things, and making sure the entire team in the organization is advocating in the right way with the right information. Clearly a great fit. That alone brings value to the company. And then being a table for that business development with that clinical conscience and knowing that there's a patient at the end of the day and there's all of that ecosystem driving towards that. So, we say Mazel Tov, and I will give you a hearty Mazel Tov for being in the role, and I hope you
Thank you.
enjoy it for as long as whatever the next steps in your career are. And all of our careers are getting janky these days; they're no longer linear. And be adaptable, and you will be highly successful from one physician to another. So,
Oh,
thank
thank
you for
you.
doing your work.
That means so much. I mean, I feel very, very fortunate to have been able to step into this role and continue practicing because I feel like that diversity of experience is what allows me to not burn out. I think
Hmm.
of clinicians out there are experiencing burnout because they feel trapped in doing the same thing every day and having to deal with the same kind of administrative burden day in and day out. And not to say that I don't have to deal with any of it, but I think, you know, every day is like interesting and exciting and different, and it's a lot of work, but
It is. It is.
it keeps me excited about what I'm doing.
Well, when we bring you back in a couple of years, we're going to address all of these questions about burnout and demand and resources, but that a different time.
Yeah.
Okay. So, what advice might you have for folks that are listening to this, thinking about a career move, a career change, a career trajectory? What might you advise our listeners to moving into an industry role? I'll give you a prompt. Would
Mhm.
you suggest they continue to have some level of clinical practice as they move into industry? So that will be binary, yes or no.
Yes.
Okay. And then if they're going to try to keep one foot in that canoe, how might they pivot towards into an industry role?
Yeah. I think it really depends on what their goals are. And I think I get that question a lot. I want to go into industry. Like, what do I do? And I think it requires a little bit of self-reflection and soul searching about what exactly about going in industry is motivating that decision. Is it purely because they want to not practice clinically, or is it something specifically that interests you? And I understand that some people are looking for an exit in some ways out of clinical practice, and I get the kind of motivation behind that. But if that's the case, then what about industry is it that you like? Do you like engaging with, your physician colleagues? Is it the policy piece of it that you want to be involved in? Is it the business side of things? Do you want to get more involved in, business development or business strategy? There are opportunities everywhere, and it doesn't even have to be what we think of as industry, quote unquote, like pharmaceuticals, biotech, or medical devices. It could be public policy, it could be healthcare media, it could be consulting, it could be running for public office. There's so many ways to diversify your experience and pivot or supplement what you're doing in clinical practice. So I think that that's the first step. And then if you want to drill down further about, what kind of company, for instance, it depends on what, your comfort level is. Are you looking to join a large company or a startup? And, you think about your own personal situation and, what you are prioritizing in terms of opportunity versus compensation, because going with the startup, sometimes is higher risk but higher reward, and it may also be a little bit easier in some ways to get your foot in the door. Um, I think if I had to give one piece of advice, though, just to kind of lay this uh, out for everyone, I would just say talk to as many people as you can. And I know that sounds like simple advice, but it's not something I was used to doing when I was in clinical practice full time. We're not used to just reaching out to someone randomly and asking for 30 minutes of their time or to grab a coffee, to have a conversation. And this is the norm in corporate America. And it's just something that we're not used to doing in medicine. And so I would highly encourage you to do that. And you just never know where those conversations may lead you.
You just made our top 10 list of advice. I just made up that we have a top 10 list and you made it. I don't know what number you're at, but that was great because I had a psychologist coach tell me or ask me, was I running away from cancer medicine or was I running towards something else? And embedded in everything you said is that choice. Are you leaving or are you running toward? And the only way to identify the why in the what you're running toward is get aware of those ecosystems. And there are many of them. And you absolutely made the top 10 advice list. So I give you
Well,
that
thank
one.
you. Well, I think again, I'm very lucky that I sort of was just plucked out of academia and dropped into this role and kind of figured things out from within. But this is kind of like how I would approach things, knowing what I know now, um, if I was just trying to kind of make those moves on my own. Because if you do that soul searching and you verbalized it better than I could in terms of running away versus, running towards something. If you know what you're running toward, then you know who to reach out to, or you can start reaching out to people who are adjacent to those areas and get better clarity through that.
You got it. You betcha. Any idea what doctoring might look like in about a decade? If you think about the students I'm working with that are first year students, by the time they finish all of their training, what do you think doctoring is going to look like in 10 years?
Oh my goodness.
Random thought. First
Yeah.
thought that comes to your head.
First thought that comes to mind is it's going to be an ongoing balance between increasing complexity, but also tools to try to navigate that complexity like artificial intelligence. So if the trend continues, things are only going to get more complicated. That's like my thought, but we'll have to, get used to relying on artificial intelligence to process all that data, which I think in a lot of ways will help with, just if you think about those moments where you're presented with a stack of hundreds of pages of medical records for a patient being transferred to your hospital. I'm hoping that certain things will be simplified like that. Certain administrative tasks, can be handled by AI, and hopefully right now, right, it's an opportunity to get this right and not and make sure that the artificial intelligence is operating in a ethical manner and being developed in a way that isn't going to cause more harm down the road.
Yeah, you're making a wonderful argument for the kind of work that I invest my time in, which is physician leadership development. The world alone is becoming more complex. The doctoring world is continuing on that exponential curve of complexity, and we as physicians have to move beyond the old fashioned, do I know how to read a journal article and critically think and make my own decision at the bedside, to this whole situation is complex and I need a whole team and a whole bunch of tools. And if I don't understand how to navigate the complexity of it, I will fail and or burn out or quit. And so we need to be teaching complex system thinking in addition to everything else that we've talked about.
Well, and I think from what I observe with medical education today versus what it was like when I went through med school, I'm happy to see that there is more attention to understanding the entire ecosystem and equipping medical graduates with that sort of knowledge, even if it's just a very cursory understanding, because it's so necessary if you're going to truly make an impact and make change within this growing, increasingly complex system, you kind of need to know
Yeah.
what the levers are and who the players are.
Yeah. Yeah. And listen, to be fair, I love it when our students say, no, we want to return to where we are in New Mexico or Arizona, do some rural based medicine. And you theoretically will have greater tools to manage the care through remote access, all those other things you've mentioned. And it's going to be just as wonderful for them if they are equipped with the resources and understanding how to navigate. Okay. All right, last question before we go to a wrap up.
Okay.
So if you could go back in time and you were just tinkering with the world of chief medical, whatever it's called, would you have listened to a podcast like this one?
Oh, 1,000%. I
Great answer.
would have. Yeah, yeah. I think I wouldn't have been as lost when I was kind of making every transition along the way if I had access to podcasts like this.
So then you have made my heart sing, because if I'm making a waypoint for even somebody 10 years too late, I'm happy with giving that person that waypoint. And that's the purpose of this show, among many others. So This has been a fantastic tea time with you. I've enjoyed every second of our conversation,
Likewise.
and I do wish to thank you very much for being on the show. Do you have any closing words before I wrap up with the audience?
No, thank you so much for having me. It's truly an honor to be here. And if anyone wants to reach out to me, they're not that hard to find on the internet.
How do we find you? Give us that. How do we find you?
My handle on all platforms is Austin Chang, MD, Chiang. And I'm on virtually every single one out there, maybe to different extents, but LinkedIn, Instagram, TikTok, YouTube, X, Blue Sky, what have you.
Well, we
Please reach
thank
out.
you for that. We'll put that in the show notes. We're going to give a shout out to Stephen Klasko for virtually and agnostically introducing us, and it's a good idea. So thank you again.
Thank
You
you.
have been listening to the Fire Chief Podcast, the only podcast dedicated to the Chief Medical Officer. Do you want to learn more about what it is like to be a CMO? Do you want to be on the show? Have ideas about the next hot mess in healthcare you want to hear about? Email me at leescheinbart@gmail.com or connect with me on LinkedIn. You can listen to the podcast on Apple or Spotify or wherever you catch your podcasts, and you can also watch the videos of the show on YouTube. Our show's website is thefirechief.podbean.com. I love talking with CMOs from all over the United States, so feel free to connect with me, leave your reviews and comments, and please share this with all of your colleagues. And in the words of Sergeant Phil Esterhaus, let's be careful out there.